Hi, I'm Dr. Mukesh Gupta from Lenest, Malad. The topic for discussion today is the moment you come to know that you are pregnant, what are the various investigations or workup or checkups that are needed for you, and when should we do it? Now, let me give you a small tiny example. The investigations during the course of pregnancy are like finding a needle in a haystack. And not just that, you're finding a needle in a haystack which is on fire. What does that mean? Meaning, not only is it important to do investigations to find those rare and problematic situations during the course of pregnancy, but also it has to be done at the right time, at the right gestational age. So the course of pregnancy is like 40 weeks, starting from the first day of last menstrual period to your expected date of delivery, or in simple words, 9 months and 7 days. So your investigations are positioned at various different times of your pregnancy or gestation so that we don't miss out any of them. So it makes a very rational sense to create a timeline and put it up in your systems or memos pad or your wherever you want to put it, on a table chart or wherever, so that you don't miss out on your important appointments. So let me start with initially. The moment you miss your menses at 4th week, we call it, because it is 1 month from your last menstrual period, you can do your uterine pregnancy test to ascertain that you're pregnant or not. By the time you're 6 weeks to 8 weeks, you need to get your first sonography. Now, the first sonography will tell you whether it's a single pregnancy, whether the pregnancy is normal or not, whether the baby's heartbeat is there or not, or whether it is an unfortunate situation where it is called as ectopic pregnancy. All this information is obtained at 5 to 6 weeks. Then at that same time, we also need to have some list of blood tests or laboratory investigations done for you. These are screening tests to know your blood group, hemoglobin, your infection status, and if there's any risk of any infection which can be transmitted to the baby. For example, hepatitis, HIV, and we do a screening test for syphilis also, sexually transmitted diseases. We also want to know simple things like what is your sugar. And last but not the least, we also want to check disorders like thyroid disorders which can impact your baby, and if there's any vitamin deficiency in you, then we need to work you up for that. Sometimes this is also the right time to do the screening test of disorders like thalassemia or sickle cell, or even to see whether your susceptibility to rubella is there or not. Maybe it may not be of great use to give you vaccine now, but at least you know that you need to take it post-delivery before you plan your next baby. The next zone of investigation comes at around 11 to 13 weeks, 6 days. So that is the end of 3rd month. Now, when we reach that time of your pregnancy, we need to get your blood test and sonography done for screening the risk of some genetic disorders like Down syndrome, etc. So you do your blood test and you do your sonography, and then this data is put into a software which gives us your risk prediction. Beyond that, as you go ahead in the pregnancy, say maybe around 20 weeks or 4.5 months, we need to do your anomaly scan. So in India, there is a legal cutoff of 20 weeks beyond which no intervention can be done, even if there is an abnormality detected in the baby. So the whole focus of the first 20 weeks is to establish the normalcy of your pregnancy. You need to see that everything is normal by that time. Once the anomaly scan is done at 20 weeks, it's a detailed scan done by a fetal medicine expert. We are all go. We know that the baby is healthy and everything is good, and we are really looking forward. The second half of the pregnancy, say 21 to 40 weeks, our focus is to see your adaptation to the pregnancy. That is, if there's any risk of raised blood pressure, diabetes, or similar such problems. We look at the development of the baby. So baby is growing well, the size is good, there is no problem to the baby, no raised blood flow to the baby or similar such problems. And last but not the least is towards the end, we are focusing on the labor. Now, when we are going through this phase of pregnancy, the second trimester, that is from 4th month to 6th month, the important steps that we do is give you vaccination for tetanus if you're not already immune to it. So that's an ideal time to do that. We also do a screening test for your diabetes, and diabetes in pregnancy is a little bit of complication. So there's a packet of sugar which is given to you, and the doctor will ask you to do the blood test after 2 hours to see if whether your sugar is rising. This is called as a glucose challenge test or not. We also check your hemoglobin and urine to see if there is no albumin coming in the urine, no leakage of protein, or if there is no sugar in the urine. Hemoglobin is extremely important to be checked somewhere towards the end of the second trimester to know whether your hemoglobin is growing well or not, because anemia in pregnancy is one of the most dangerous factors which can lead to a lot of complications at the time of labor, like postpartum hemorrhage. Sonographies towards the later half, the last 3 months, become a useful tool of investigation to know whether the baby is growing well, whether the blood flow of the baby is nice, whether the biophysical profile of the baby is good. That means the liquor around the baby is good, the fluid around the baby is good, the baby is moving well, the heart rate is moving well. And that investigation can be done by doing a growth scan or a Doppler flow scan, depending on what your doctor chooses to do. And the good time to do your 3D scan is 26 to 28 weeks. Lovely images are obtained then. Don't miss them. By 30 to 34 weeks is another good time to do your scan to see if the baby is doing well. Towards the last part of the pregnancy, your blood pressure and your urine albumin may be checked a little more frequently if there is edema or weight gain or similar such things. Besides, if you have any disorder like say thyroid disorder, hypothyroidism, you may have to have a frequent thyroid blood check done. If it is a hyperthyroid, maybe every monthly. So it all depends on if you are having an ongoing disease, and accordingly those investigations are added or planned better. Towards the last part of your delivery, that is the last month, there will be sonographies done to check if the blood flow to the baby is good or not. That's called as Doppler flow. And that is more important if the baby is not growing well or not doing great, and if you have situations like diabetes or hypertension or raised blood pressure or similar such things. In the end, I would like to tell you that whole protocol of investigations can be broadly divided into two sets of investigations. A, to see whether your baby is healthy. B, to see whether you are healthy. And your doctor knows best. Trust him. Please follow the instructions and the timeline and the appointment schedule, and that will help you have a very healthy baby. Thank you.